momentum pulled me in, and I was in that sand reclaimer roller with my arm clear up to my armpit and was literally having my arm ripped off my body. They told me, hey, listen, you know what, you're going to be disabled the rest of your life. That doesn't set with me. And now all these years, and I've created a technique that works on the top strength athletes on planet Earth.
It's time to sit down, keep it real, and cut the bullshit. Welcome to Table Talk. All right, guys, we're back with another episode. We are back with another episode of Table Talk. Leave that in because this is authentic with Dr. Todd McDougle, the Strongman doc.
You mean the first 10 times weren't authentic?
Yes, exactly. Not at all.
But original.
Yeah, we'll get into your history. You've been working with strength athletes for 25 years, chiropractor for over 30 years. But the question that I want to jump off with is an odd one because we're about the same age, right?
Right.
So I train in the mornings, and this morning when I came in, I super didn't want to train, like big time didn't want to train. Mm-hmm. Still going to do it anyhow, but it was on the scale of 1 to 10, it was like the 10 of not wanting to do it. Mm-hmm. So I'm flipping through different playlists because sometimes that kind of works, right? And I see this playlist that says 80s pop music, right? And I click it, and I hated this crap, back in the 80s.
Yep.
It brought my spirits up, so I was able to train a little bit more effectively. But my question is, this is the crap I never listened to, ever, mm-hmm. right? But it's probably on the radio all the time. How do I know the words to this stuff? And then is that the same with you? Like, You hear that music, and it's like, this sucked back then, but I know the words to it.
I knew both. I know the songs that suck, and I know the good ones as well. And, and of course, we also go back into the 60s and 70s, you and I. So there's a lot of music. Yeah. There's a lot of music. And then, of course, I think some of my favorite music came out of the 90s. Yeah. Which I had kids in the 90s too, right? So, yeah, it's just crazy. But, yeah, I think it's that loop.
It's a weird thing, man. It's the Top Gun theme anthem.
Mm-hmm. Like, you're making me really worried now because in 2 years, I'm worried that I'm going to start liking the music from the 20s now.
You will.
You may.
You will.
Yeah.
And that's truly terrifying.
Yeah, it's like Top Gun intro music or whatever it was. Then I'm ready to train. Like, I made fun of this.
Yeah.
I even made fun of Eye of the Tiger, by the way, because it became so pop.
It was cheesy.
That it was like, this song sucks.
But don't you think, though, a lot of times, they say that there are certain things such as smells, music, sounds, light, things like that actually cause you to regress back into your memory, right?
Yeah.
And maybe what happened was that pulled you back into the 19-year-old Dave Tate.
Oh, it did.
And then, it just kind of refueled you.
The brainwashing worked.
Yeah. And, now that's
the propaganda with Eye of the Tiger.
Right.
All it was this whole time. Yeah.
I don't know about, brain neuroplasticity, but I can say it. Yeah. So maybe that.
Mm-hmm. Yeah.
Okay, so jumping way back.
That's a big one.
It is, I know, right?
Why did you decide to go into chiropractic?
Okay, yeah. Interesting story. I believe it or not, I don't know if it says this anywhere, but I used to be a police officer many years ago. And I thought that was going to be my career path for the rest of my life. And at one point, it looked like that department I was on, it wasn't going to be a good fit. So I thought, I'll go ahead and I'll go into the state police. So I went ahead and separated for a little bit. And while my application was going through, and what ended up happening was I ended up picking up a part-time job. That part-time job led me to this one particular foundry in which I became injured. The accident itself was as simple as, one, you couldn't hardly see because it was a foundry. It was 104 degrees in that foundry that day. I remember going out to lunch, sitting in 100-degree sun and feeling cool, mm-hmm. right? And it takes time for your body to go ahead and get beefed up, to that ability to handle the heat, right? But at any rate, we were getting ready to clean up. It was at the end of the day. I was sweeping the silicone sand. Many people don't know that a lot of metal parts are made using silicone sand molds. And of course, what happens is that when the part gets, the melted goo goes into that mold, it gets shook apart. And then one part, the part itself that is now now solid metal, it will go down one path, and then the sand will go ahead and drop off of the shaker, and then that will go to a reclaimer area. Well, I was sweeping up the silicone sand. We were dumping it back on the reclaimer belt, and what ended up happening is that unbeknownst to me, the main or the primary drive rollers for the silicone reclaimer was right behind me. The broom that I had got caught in that roller system. Those were 2 rollers about the size of 55-gallon drums rolling 30 mile an hour. The broom got caught, the belt skipped, but the momentum pulled me in, and I was in that sand reclaimer roller system with my arm clear up to my armpit for 8 minutes is what they said, while I was hanging onto an upright that went up to the dump station, if you will, for all the sand, and was literally having my arm ripped off my body. How
far apart were the rollers?
They were probably about a half an inch apart.
Yeah.
And then they have, like a 500-pound weight to hold them to keep them from bouncing around. So it wasn't going to go anywhere. Kept the presence of mind not to put both hands in. Almost did it because, your instant response is to push away.
Yeah.
And I'll be honest with you. I think, some of the police training that I had in the past to keep my head, I think that's probably saved my life at that moment, because it was, you can't even say split second. It was shorter than that, and I remember yelling at myself and saying no. So I got caught in that, and it did break my arm. It did tear off, started tearing my arm off of the AC joint. I've got a spot where it blew pressure out and a hole outside of my skin, busted the humeral bone. And then it was crazy because they had to basically, well, let me put it this way. When you hit your thumb, it swells, right? When you hit your whole arm, it swells too. And so the end result is that my whole arm swelled, and it swelled so much that the skin and the fascia that hold the muscle and give it shape, all of that was so full of fluid, it was shutting down blood flow. Then they call that compartment syndrome. So I was suffering from compartment syndrome, and so they had to go in and do emergency surgery and literally fillet my arm open so that it would release. But, it took many, many weeks for my hands and my body to actually decrease that swelling, because it's a significant pressure wound, right? You can see right in here, you see that little dot there? Those are scars. My fingers turned into banana fingers, and they were in that position so long that the skin between my fingers started to rot. And so I got a plate in the arm. They screwed plates into this radial bone right here, and then they hung me off of an IV pole in an upright position. And I laid in bed for 3 months while my body was trying to figure out what the heck to do with it. I also at the same time tried to make my hand move, right? So continually tried to make it move. You know how it is when you get all pumped up and you're getting ready to do that 500-pound deadlift, and you grab hold of it and you're like, okay, I'm in the zone. I had to do that to get my thumb to twitch, and it finally did. It was kind of amazing. The doctor comes in. That was on a Wednesday. The doctor comes in on a Friday, and he says, "I don't know what you did. I don't know how this is happening, but he said we had you slated for arm amputation on Monday." I mean, that's crazy, right? So fast forward to me trying to get, I'm in the 230 range, body weight wise, had lats, was in really, really good shape for the most part. And they said that's part of the reason why the blood flow did what it did in a good way as far as recovery. But I dropped all the way down 165 pounds. Well, I'm almost 6'3".
So that training beforehand, was that bodybuilding related?
That was bodybuilding related, yeah. However, it was always got to throw in your high school lifts, right? Because you always got to do that.
How much do you bench?
Well, you know what? I'm glad you asked. Thank you. So yeah, I had a 410-pound bench press in high school that weighed 195 pounds, which back then, in 1984, that was a big deal.
Yeah,
number.
That was a big number.
Still is a big number.
It's still I can't do it anymore. It's a really big number for me, right? But anyway, while I was going through that process of trying to get my weakened body, that 165 pounds, I did the long walk to the YMCA in Warsaw, Indiana, and started training and started making gains and, tried to get my hands to function and work. And, I've lost during this process, I've lost half my bicep, brachialis is missing, some of my tricep, I'm missing both lats. I don't have an armpit on the right side, which the upside of this is I save about 50% a year in deodorant. So, there is an upside, there I am being sunshiny. But the skin grafts all came off my thighs. First lat transplant failed. They had cut the other one out, took a vein out of the lower leg, put that in the arm. And then I went to town, just started working out, training again, that kind of thing. Well, in that interim, to finally get to answering your question, I hurt my back. And one of the guys I trained with, his dad was a chiropractor. And he said, so, why don't you go see my dad? I'm like, well, I'd seen chiropractic in the past, whatever, that kind of thing. It's like, no, really, go see dad. And so I went in, saw Dr. Prahaney in Warsaw, and it was like, wow, this is amazing. Because I walked in literally all hunched over, and which was a good look because my arm already did this, right? So, and all the scar tissue. So anyway, he got me straightened out as good as he could, if you will. And I started asking questions. I thought initially, maybe I'd go into PT. I was trained in PT, through a vocational program, many years before in high school. But I was one of those kids that was an in-betweener. And at the time, they didn't give out student loans for college. You remember those days? Good luck trying to get any money from anybody. So I worked, and that's why I ended up going the route that I did, and, became a cop and did those kinds of things. Went to school finally later with 4 kids because, I was a little late in life with that as well, and graduated about, age 32, and then just kind of go on from there. I don't want to take over all your questions, but there's, I could keep going because it's a big story, right? But it is one of those things that, to overcome those things, the mental challenges and the fortitude that you have to have, recovering from an injury. It's one of those things I can relate to those people, even though it's a different kind of injury, to those people who've been in the military, who've suffered some severe, damage, people who are amputees, people who may not have a leg, don't have an arm. I can relate to those guys because, this kind of injury was pretty doggone traumatic, and being in that thing for 8 minutes while it's eating you alive is traumatic. It just is.
Yeah.
So you were practicing. Yeah, go ahead.
I just want to touch a little bit on that because I was in a similar situation where my hand was slated to be amputated and they barely held off, and then I forced it to start recovering, and then these multiple surgeries that I did actually made it functional now, and I'm glad they did. During that recovery point, and this is maybe a good subject to touch a little bit on, especially in your situation, it was very difficult at times to force myself to keep working through it because I was barely seeing any progress. And at the same time, even seeing that tiniest fleck of progress made me so excited that no matter what training before that, and I went through some gruesome trainings, military service, etc. before that, that little bit of fleck of progress in this damaged thing that I've managed to recover back made me happier than all the training that I did before that. So I wanted to ask, what's your emotion or feeling going through that?
Here's the thing. There are victims and there are victors, and you become victorious, I think, to some degree. You're pushed when there's no safety net. I didn't have a safety net. I'm on my own. There wasn't anything that was going to help me, even though they told me, they say, hey, listen, you're going to be disabled the rest of your life. No, that doesn't set with me. That's not who I am. I'm not disabled, In fact, while my arm was still all, literally it scarred up like this, right? I was doing Rocky push-ups with my good arm. So I'm doing single arm push-ups trying to get my body, to come back. They wanted to go ahead and put rubber bands on my hands to go ahead and get my fingers to do weird things, but my fingers were like this. And I thought, you know what? This is all scarring up in through here. What makes sense? Well, why don't I do push-ups on my knuckles? And so I started getting my hand to where now I can do this, but that was push-ups on my knuckles. Start off one arm, and then it was like, okay, can I get it stronger again? Can I push it? Can I balance it? So everything, it had to do with, I don't have a place to fall back on. And that, I think, gave me strength. But also at the same time, I didn't want to be handicapped. I didn't want to be called handicapped. And I think that pushes in there. Don't you think? I mean, you've got your hand working again. Why? Well, you could have just not.
Yeah, I could have not. And I could have accepted what the doctors told me. And that was the driving point, that the doctor said, you'll never be able to do more than this.
Yeah. They told me I never bodybuild. I'd never power lift. They told me I never do any of these things. And now, just go ahead and go forward, all these years. And I've created a technique that works on the top strength athletes on planet Earth. And
joke on them, huh?
Yeah, wow, right? I mean, I'm doing the best that a almost one-armed guy can do, I guess.
I've been told that I couldn't do certain things from orthos many times. And the thing that I was never able to wrap my head around is the one time it was after the pec rupture, it was you're not going to bench over 400 pounds again, right? And like, where's that come from? Like where did you pick up 400 pounds from when it was 520 to begin with? And if it's 400 and with a little bit of training, I'm pretty sure I could do 405. And if I could do the 405, I'm more concerned about like the 135 that I have to do post surgery. But if it's, that's what always confused me. Like if you're telling me I can do this and I can build back up to 135, then just regular strength training should get me to like to 140, as in like 145. And then, so it's just these stupid. And I get why they're doing it. They have to protect their ass or whatever it's going to be.
Some of it is that, but also at the same time, you got to remember the education space is a safe space for them, and they have most institutions. I'll say most rather than all. Most institutions focus on dogma. Okay. They focus on groupthink. They also, at the same time, really have very little real world experience in those safe spaces. And so it is basically a situation in which college is based upon theory, isn't it? And so we keep hearing things, like the term evidence-based medicine, evidence-based care. Well, the educators like to take control of that and say they're doing evidence-based information, evidence-based care. But really, if you go ahead and you go back to where that whole idea came from, it really is one of those things that most education and the principles behind it have been observation-based, not real world on the ground activity based. So evidence-based care is really what you do when you take the patient's needs and desires to perform in our arena, where it's strength care. You then take the doctor who has to have skill sets. If they don't have skill sets, you're not going to be able to take that to the third step, which is making sure that you're taking the information, making observations, and doing boots on the ground care to go ahead and allow that patient to reach number one, which is their goals and performance. Right?
Yeah, I would add one more layer to what you were saying with the medical community, and that would be if you have a specialist, right, the electrophysiologist or the orthopedic that just does the hip replacements. They're very, very, very skilled at what they do because they have to have very high knowledge in what they do.
Yes.
So their scope is very limited. So when I'm speaking about the ortho that's talking to me, his skill is reattaching that tendon in the best manner possible. After that skill, that's not his wheelhouse.
Yeah, he's probably not the guy you're going to want if you just had a car crash and you're in the ER bleeding out. He could be helpful.
Yeah, so the specialists are specialists for
He'll stop the bleeding, but
yeah.
And very few of them will try to tell you what you need to do physical therapy wise because they understand. The good ones, the best ones, that will understand.
Experienced ones.
Yeah, the experienced ones will understand that's not my wheelhouse. That's where you go here or here, and they kind of move it off to where you know, the electrophysiologist isn't going to talk to you about the plumbing that has to deal with your heart. They're going to talk to you about and that's when you get up that higher skills. Where things get dodgy is when you go under the specialist into that layer before that. That's where it gets really convoluted because people think they know everything.
Well, yeah, we see that in chiropractic, especially because, you know, and not to jump ahead too far, but if you go ahead and you look at what I've done over the last, you know, almost 30 years working with strength athletes, is I've taken the very basics and then I've plugged it into Triage, compliments of Chad Coy. Chad Coy, which we all know Chad. Yeah. Chad's an amazing trainer, works for Parisi, and has been a long-term friend. And you know, we're going to blame him for me getting into Strongman, okay?
Well, if I understand, you were practicing, 4 or 5 years before working with Chad?
Months.
Months,
yeah. I graduated in October, and then I started training with Chad in 1998.
He basically did his residency on Chad.
You got that right. And, you know, we always tease, you know, Chad is was my guinea pig.
Well, that's interesting, right? Because your formal education base contradicts a lot of what the things that you were doing with Chad.
100%. And that's the thing, you know, and that's where evidence-based science actually, you know, meets the rubber meets the road, because Chad was like, hey, listen, you know what? I love getting chiropractic adjustments. He says they work. He said, the problem that I don't understand is why in the world do I feel as though my body has been sprung? In other words, why is it that, you know, my strength pattern has changed significantly afterwards? And is there something you can do to make that better? And I said, I don't know. I said, are you willing to experiment? And he says, sure, let's figure this out. And, you know, and I'm not a real sciencey guy, but I'm a practical, you know, mother of invention kind of guy, you know. Well, if this works, then okay, maybe we can make this work better. You couple that with the seminars that I used to go to, and I'd hear the old doctors in the back after watching somebody do a technique, and they said, well, you know, you have a short leg over here, you know, you do this technique, and then afterwards, the legs straight, voila, it's magical. And then the doctors in the back are like, yeah, walk around for 5 minutes and it'll be short again. And I'm like, okay, well, that's all well and good, but why are you not trying to figure out a way to not make that the case?
To put some context behind what he was saying, because I understand this fully because I came through that whole generation, is, say my back's jacked up. This is for the audience. And I know it's jacked up. So I go to the chiropractor to make it not jacked up, so it doesn't hurt or whatever. Pain's on a spectrum, so it felt weird, not right. I don't want to say pain because I know what real pain feels like. Yes. It's not like real pain, it's like dull type of thing. Then I get adjusted, like, damn, this feels good, but I don't feel tight. Right. I don't feel like I can brace like I should be able to brace.
100%.
But I don't feel that uncomfortableness. Yeah. But this uncomfortableness is actually scaring the shit out of me as well. So it's for me, it was more of, I got to time this shit, you know, to make sure that whatever that time it took me to reacclimate. And normally by that time, it would start to ache again anyhow. Yeah. Right. And it's like, well, what the hell?
Well, and you're looking at, and if you go ahead and you go, I'll explain why that all is here in a second. But, you know, if you go and you look at it, it does take time for your body to go ahead and get tightened up again. You know, powerlifters, strongmen, you know, people in strength sports, they have to have mobility, but they have to have that tension also. And if you go ahead and you look back to what happened back in the mid 90s, in sports science, they got away from doing things like static stretches, which is basically like your toe touch, right? So you got your toe touches, and then if you know you wanted to go ahead and get a little bit more, you go ahead and do the bounce, right? And that's what we did in high school.
Is that we had to do?
Yeah, that was, and that you had to do it.
Reels.
Yeah, so almost.
Or windmills.
So, but the windmills probably were better than the toe touches, and exercise physiology got to a point they're like, okay, listen, you know what? We need to get away from that because it's affecting performance in a negative way. And so what research they gathered to go ahead and prove that point, to make that change, went all the way back to 1910 to a guy by the name of Hoffman. And Dr. Hoffman postulated that if you go ahead and you do a static stretch, that changes the threshold of neuromuscular recruitment. In other words, the number of fibers that you're able to go ahead and maximize to produce force for strength, right? In order to move things. If you go ahead and you do a ballistic stretch, it exponentially makes that recruitment worse.
For how long?
Well, and I think it's truly sport dependent. I think a swimmer is going to be a lot different than a power lifter, where you've got, a wide variety of strokes versus, one stroke, when you're going with maximum effort. So I do think it's sport specific. The interesting thing is that what I discovered is that if you go and you look what 90% of my colleagues in chiropractic are doing, and everybody else who wants to try and be like a chiropractor, they're doing this thing that's infamously known as the side posture roll.
Are you feeling like you're not the man you're supposed to be? Low confidence, negative thoughts polluting your brain. That's me. I get it. I've been dealing with messed up hormones most of my life. A couple of years I hooked up with Merrick Health, and it was one of the best things that I ever did. They're a health optimization platform that does advanced lab works and goes deeper than probably what you've ever seen before. What you'll get with Merrick Health is they have guided optimization and the self-service diagnosis. I personally have been using the guided optimization for the whole time I've been with him. Dry is my health coach. He does an amazing job. The second route that they have is the self-service diagnostics. This is just a DIY with your own health journey. You just head over to Merrick Health, pick the panel, and they'll send you the report. You just kind of go from there. Either way, I highly recommend them, and you can get 10% off right now. Just head over to merrickhealth.com and use the code TABLETALK at checkout.
Okay. Now, if we go ahead and we break that roll down and we go ahead and say, okay, what are the components of the roll? Okay. You'll go ahead and you'll put that patient on their side. You'll go ahead and bring that leg over. You go ahead and push that shoulder back to some degree. And then what you do is you get that to tension. Isn't that called a stretch?
Mm-hmm.
When you go ahead and you take that stretch to tension and then you go ahead and you release the joint, isn't that called a ballistic stretch? It's a passive, right? Yeah. It's a passive.
Like you're doing windmills explosively.
Well, it's worse, right?
Yeah.
Yeah. So what's happening is you couple that with this one other piece of information. How many joints are involved during that activity? Just that treatment. You've got ribs, you've got shoulders, you've got neck, you've got, knee joints, you've got muscles, you've got, everything. So is it any surprise that your strength and power is going to be blown? And it may take anywhere from 24 to 72 hours, depending on the athlete, for recovery. So what my job was to do was to take that information and figure out a way that I can enhance the power and mobility without affecting negatively the strength. So using the drop table mechanism that was introduced in the chiropractic at Palmer College of Chiropractic in 1961, Clay Thompson put together, I've developed a short lever, high velocity burst application. And I think what that does is it's more of a closed pack as opposed to an open pack. All right. Now, closed pack is basically when the joints are closed together. You get maximum movement, but also maximum stability when things are in closed pack, which makes sense, right? So it also at the same time protects the discs, right? The discs typically, especially in the low back, tend to blow out sideways or posterior. So what I had to do was I had to come up with a way. So I structure my movements and everything else around to where, one, it protects the doctor. So even as big as you are, I can teach a 125-pound female chiropractor how to take care of you without hurting yourself.
And I've seen you work on some massive guys.
Well, I mean, whether it be, Brian or Tom or, OB or, whoever, Hathor, anybody. I mean, you're looking at, up to 475-pound guys at 6'9". I had to figure out, because I don't have one good arm, right? So, and I've done it. And so, like we were talking, off camera here a little while ago, we've seen athletes that strength wise in powerlifting meets have had a 20% increase in strength right off the table. So we did it. And so, doing almost 30 years of working with the top strength athletes on the planet, there's consistency. Because here's the thing. I always tease, Eddie Cohn whenever I see him, or Magnus for Magnuson. I go, you guys are all like the GOATs, you're like legends and stuff. How is it that you can do all, you've done all this and I'm still working and nobody even knows my name, mm-hmm. But if you think about it, how many times am I allowed to miss in competition? And how many competitions have I done? And how many thousands and thousands of patients and athletes that have I treated? You know
Well,
how
if
many
you treat someone wrong, you're directly responsible then for his performance.
people,
So, yeah.
you're going to get blamed,
Yeah.
whether you are or not. The end result is you're going to get blamed. And so, how do you go ahead and you got to hedge your bets, but you also have to take the knowledge that you acquire in the office, with doing proper radiographs and things along those lines, which, a lot of my chiropractic colleagues have given that up because they're just that good. I'm just like, my God, data. The more data you can collect, the more hard data, the more visible data like x-rays that you can see, that reduces the patient's risks and also at the same time gives you an idea of how close some of these problems are that could cause, a catastrophic injury. I'll give you an example. People, talk about scoliosis, well, the formal scoliosis number is 10 degrees. Well, 10 degrees or more is scoliosis. Now, there's different kinds, idiopathic being, well, we don't know why it happened, right? And that's fine. But the thing that I think is interesting is that we have all these wise doctors. I left the second half of the word off, but we've got all these wise young doctors who are coming out and they're saying, well, I don't need any x-ray, but you know what? I'll go ahead and take a set of x-rays. And I've got people who are having issues, they say, for example, they break early when they deadlift, people do that. That's fine. Well, if you take a set of x-rays and you find out that this person has what's called a hyperkyphosis at the T12 junction, which shouldn't be there. I call it a dolphin fin or a turtle shell. Well, if you structurally already have a break, you put it under load, you're going to break. You're always going to break. You can't flatten out your back.
But my question with that is, you don't have a baseline to look at, right? So that just may be their physical development, basically how God put them on that earth, because there's no baseline, right? Where you still have to have a baseline, where I agree with you on the people that don't use them. How do you know if anything's getting better or worse if you don't have, it's like blood work, right? If you don't take the blood work, you just assume you're always freaking healthy, right? But the first one, really, it can tell a lot, but you really don't know until you have multiple blood panels to be able to know maybe this is a genetic marker, maybe that's really not going to change.
And here's not just multiple, consistent ones.
Yes.
Well, here's a component here, okay? The same individuals say there's no value in the x-rays are the ones that say, well, we really can't see a lot, it's bone out of position, it's pressure on hose and things along those lines. Well, some of those were just ways to talk to lay people. But here's the thing, most of the time I'm the guy who everyone comes to when everyone else has failed. And so I often one of the first questions I ask is, anybody take an x-ray? And the answer, I would say 90% of the time, is no. And so I take a picture and it's like, oh, okay, well, the reason that you're having these seizures right now, the reason that you have to do a catheterization on your bladder, the reason why you're having to have enemas in order to go ahead and have any excretion whatsoever is because you have a 2-inch leg length deficit, which is causing pressure on your sacrum, which is causing there to be a curvature, which is also causing you to have a terrible shift, in your body weight and whatnot. And so those are the easy ones to identify. The hard ones and more difficult ones are the ones that are so close, millimeters even. But the thing is that so many of our young doctors will go ahead and look at it and say, oh, well, you know what? There's really not that big of a difference.
It's just a millimeter or two.
Well, yeah, but again, it's more than that. It's about when you go and you take a look at those x-rays, how you as a chiropractor interpret them. Okay. So that is an art form and a skill set that takes many, many years of practice, over and over, repetitions, right? Whether it be jujitsu, whether it be your squat, you have to have repetitions. Chiropractic's the same way. You have to have repetitions so that you eventually get to the point that you can look past what it is that's on there and then do a comparison and data analysis and then blend it together. So just because, a young doctor will say, well, I really don't get anything off the x-rays. Well, that doesn't mean the x-rays are bad. That means you suck as a chiropractor.
Well, on the flip side of the x-rays, you're going to have the patient that has ignorance. Right.
100%.
This I've had happen multitude of times, right? They'll take the x-rays, they'll throw it up, and they're going to tell me everything that's wrong. Right. And I'm looking at it like, I have no idea what the hell I'm looking at.
Yeah. Well, to your point, they actually, several chiropractors years ago used to joke that they could take a pelvis, flip it upside down, and tell them that's your head.
Yeah.
And the patients have no idea. So I think a conscientious doctor that will go ahead and say, okay, let's bring it all in so you have a full comprehensive understanding of what's wrong and what it is that we can do and how and how long maybe it's going to take.
Well, if we go back, 25 years ago, with everyone I ever saw, there was always something wrong. Right. And then I always needed to have 3 treatments per week for 6 weeks because that was what the prescribed.
I'd love to address that too, because I think that's huge.
Because that's when I was like, see ya, I'm out of here.
Yeah.
We'll find somebody else.
Just to jump in with that quickly, like you can also have the opposite situation where I dislocated my collarbone during a deadlift in a competition. And I knew almost for a fact, 90%, that there was something wrong with it. I had 2 x-rays done in the multitude of like 3 weeks of constant pain, couldn't sleep on my side, where the first one, the doctor's like, no, there's nothing wrong with it. It's fine. It looks fine on the x-ray. We did a second x-ray. He said it looks fine until I literally told him, look, right here on this bone here, it hurts. And then he started looking through it very closely. And he's like, oh, you're right. It's actually dislocated.
Well, and swelling looks smoky on an x-ray too. So he may not have been able to see exactly what was going on. But to your point, in regards to the number of treatments that are required and whatnot, there are management companies that will go ahead and say, okay, listen, you know what? I don't care how bad that patient is. You never adjust them on day 1, always day 2. Well, why? Well, it's a control thing, which I don't like that. I don't like it when, I remember I had an issue, and the doctors, once they get their hooks into you, they just drag you around, and it's like, okay, you need to be here at this time, you need to be here at that time, and I don't care that you have to work. We're what's most important right now. And I think that, chiropractic doctors have fallen into that trap, management companies and whatnot. But the thing is that you also look at, like you said, maybe the 5 times, the 3 times, the 2 times. And I remember, in a board meeting, one of our chiropractic colleagues says, why is chiropractic not advanced? It's still the same thing that we did. And he's 20 years past me, and I think a lot of the reason is because chiropractors have figured out, as a whole, that, there's a way to make money and then there's a way not to make money. And if you actually get people better, you make less money. And it's true. It's true. I mean, I will say it is true, because here's the thing. I mean, I am the guy, like I said, that I'm always the last guy, but it doesn't matter really how often or how bad that patient is. Typically, when I get them in there, I go through the process, do the data analysis, and the end result is that, okay, this is what I'm going to do. I'm going to adjust you. I'm going to leave you alone for a couple days. And then before the weekend, I'm going to tap on it again, and we're going to hope that you have a good weekend. Now, does that sound unreasonable?
No, it's pretty good.
And it's very practical, right? Well, guess what? Our success rate after the first adjustment on the day that they come in and get an exam, I mean, the results are astounding for these people who've been suffering in many instances we had the one gal that I just described with the bowels and the bladder and 4 years. 4 years. So she goes to her medical doctor and she gets shots in her hips for the last 4 years. She walks in and she says, I don't need those shots anymore. Well, what do you mean? Well, you got to sign a waiver. Well, I don't. And it's like, what's wrong with you? She goes, I feel better. I'm going to a chiropractor that knows what he's doing. Now, that's the hard end of it, but they're also at the same time as the higher volume chiropractors too, which we need those as well. We need the soccer mom chiropractors. So everybody has their place, but I really think that, if part of the reason that it's hard for, somebody like myself to actually, retire early is because of the fact that we're successful. The motivation isn't there. And on the front side, people don't want to come to me because they're seeing the $45 ads on Instagram and they're like, well, that's outrageously expensive. Well, hold it. I just changed your life after 4 years. What is that worth? Because your medical doctor could not do that. Your physical therapist, as good as they are, they couldn't do that. It's chiropractic is special. It really is. And I really, really hope that, I've made enough people angry that they'll change what they're doing, with your help, of course, because chiropractic is so amazing if you just do it the way it needs to be done for that patient.
So if we spin this back to when you were working with Chad, what did that look like? Because there's a trial period, right?
Do you know how many times Chad swung at me because of trying to figure out how to get those ankles to move in such a quick fashion and be effective? Because sometimes it hurt.
Yeah.
So
what was your intent, right? Because we know what his intent was, Right. He wants to be able to stay healthy, to be able to compete and not have the sessions hurt the training.
Yeah.
Right. Now, on your side, you got to be able to change everything that you've learned.
Yeah.
To be able to apply new things that you haven't yet discovered.
Yeah, exactly. Well, I think part of it is again, we talked about mother necessity. I only have one good arm. So there are issues with me trying to do a side posture, all right, and try and get that into a good position because my arm does not straighten out, all right? So as good as that technique can be, and like I said, everybody wants to do it, whether you be a PT or massage therapist or athletic trainer, everybody wants to play chiropractor, it seems like. So the thing for me was, number one, not to let my friend down. That was the most important thing for me. And then figure it out. The goal was, how do we keep Chad Coy from getting sprung? And so we just, like I said, we did this, that didn't work. Let's go ahead and try this. Let me see how I can get the maximum leverage, how I can go ahead and get the most impact. And, you can see a lot of the videos. And, actually, I think Martins Lisi had a video one time, a YouTube video, and he says, you know what? He says, Dr. Todd's probably one of the most violent chiropractors I've ever seen. He says, there's no other word for it. He says, but it works, And so the goal was, one, not to let Chad down, and two, to really, really figure it out and how to do it in such a way, because you're dealing with a lot of athletes, for example, that have high blood pressure. You don't want to lay them on their back and just go ahead and start cranking on them on that neck. You can give them a stroke. You don't want to do that. Now, the likelihood is very, very minimal, all right? But, you want to try and hedge your bets.
Yeah.
Everything was about safety first also. So don't let Chad down. Figure it out. Try and make sure that you're not messing with their performance. And then also at the same time be safe. So every time you go ahead and you do an adjustment, you're safe and you're being effective.
So when you say you try this, then you try this, what is this or this?
It's hard to describe. We'll go ahead and maybe say, for example, and again, you have to go to some of the videos that I have, on the strongmandoc.com or the Strongman Doc, videos that we have on YouTube. But you'll see me lift a leg into position, and hook it with my arm and then lock it into that position, have the drop cocked and then, set it. Okay. Well, which way works best of that? Or do I go ahead and forego this method and then maybe just go ahead and use a block and then hook in and drop down on the same side with the leg and pull that in? So what's happened is that some of the initial one step or one focused adjustments, like say, for example, the one I just described was like a PI or a posterior inferior ilium. If I go ahead and I am able to go ahead and lift that leg up and kick it in and then drop it, okay, that's one move. But here's the thing. What I discovered is that I can actually move several things at the same time. So next it's like, now we're going to put in a wedge. Then we're going to go ahead and we're going to bring the leg out. So now I'm affecting internal rotation of the hip socket, right? I'm also at the same time putting pressure on the joint to open the joint up. And then in addition to that, I might also be resetting the sacrum at the same time with one move. So it's actually a multi-release application. It's kind of fascinating. So you start with one thing and then it becomes a multitude of things. Now, the other component is that if you're going to go ahead and change a pain syndrome or a pain pattern, you need to create, as far as I'm concerned, I think you have to shock the system a little bit.
Staying hydrated is huge for training and performance. And this is why today's episode is brought to you by Element. Element gives you exactly what your body needs: 1,000 milligrams of sodium, 200 milligrams of potassium, 60 milligrams of magnesium, 0 sugar, and no junk. Personally, I like to mix half a pack with my morning oatmeal. I'll use any of the chocolate flavors. I drink it with all my training sessions, watermelon being my favorite. Some other reasons why I use it is stable energy with no crash. It fights off fatigue and cramps, improves mental focus and clarity, helps regulate stress and supports deeper sleep, and there's no sugar and garbage. Here's the best part. You can try it totally risk-free. Right now, Element is offering a free 8-count sample pack of its most popular flavors. With each purchase, you get 2 of each of these 4 fan favorites, perfect for finding your own favorite or sharing with a friend. Don't like it, give it to a salty friend, and Element will give you your money back. Head over to www.drinklmnt.com/table talk.
And so when you see me, and you see me do it a lot, but you go ahead and you do that drop application with one movement and you hit 3 or 4 items at the same time, you've just changed the neurology, but you haven't stretched anything. So what we end up having is more power and more mobility. And people get off the table. I mean, you've been on the table and get off and it's like, oh, now I can do ass to grass.
Now, when you say change the neurology, what do you mean and for how long?
Well, it depends on the person and how chronic their problem is. And unfortunately, a lot of strongman athletes are very, very chronic. So I get to hide behind the fact that they just, went through 5 major events, right? If you go ahead and you look at most events being 5 events, finishing with the stones most often, what we want to do is we want to see how long that would last, to answer your question. And I've had athletes that have gone through a grueling entirety of contests with me being the only provider there. And that was another thing too. When I started doing contests, I was the only guy there. So this whole concept of recovery started with this guy right here, which is pretty cool. But I can share another story with that. But yeah, they go through that entire grueling 5 event, come back and still not need adjusted. That says something. We also have had athletes that, would go ahead and get adjusted, and then they call me back and they call me or send me a message and say, you know what, 2 weeks later, that adjustment still has held. Well, isn't that what, coaches want? Isn't that what, the guy who's, the pipe fitter, the garbage man, the mom with the back pain, the kids, isn't that what everyone wants? Isn't that what the power lifter wants?
Absolutely, yeah.
So for me, I thank you for giving me the opportunity on your platform to share this, because it is so important in a time in which chiropractors are giving up on chiropractic. And what they're doing is that they're losing the concept of how powerful the adjustment can be. And they're selling red lights, or they're wanting to sell you a vitamin package, or they're wanting to, try and play massage therapist, or they want to be the athletic trainer now, or they want to be your coach, or they want to be the manual massage therapist, or anything, God help me, anything, but don't make me adjust anybody. And that's where I see the profession going. And so as time has gone on, this is why now, I'm a member of the ICA, which is the International Chiropractors Association, which I've been involved with for many, many years. And now I'm a board member. And then also now I'm the chairman for the ICA Council on Fitness and Sports Health Science, which was always tied in with the Arnolds for many years. But what we're trying to do now is I want to create an environment in which we're educating chiropractors how to do the work and how to be good at being adjusters and be adjustment focused and chirocentric, if you will. And that doesn't mean that the other stuff doesn't have value, but we're losing something long term if we just keep giving up on being a skilled adjuster. So I want to create a opportunity and a template to share this knowledge with chiropractors worldwide. And now our goal is to, through the Sports Council, create educational programs and platforms to do exactly that.
Now is the other stuff additional revenue streams, or is it because they're not having success doing the chiropractic?
Yes.
It's both.
Yeah. I mean, it's hand in hand. I mean, if you go ahead and you look at a chiropractor today, it's $300,000 for the most part to go ahead and be a chiropractor. That doesn't include your undergraduate stuff. Okay. So, when you fall in love in chiropractic college with this other gal, you just picked up another $300,000 of debt at least. How are you going to get that paid off in your lifetime? Should never happen.
To this note then also, especially when you're saying that there's a difference in what you're doing in those volume chiros, like my wife and some people I know went to a few, and I was, until I met you in person and seen and felt what you can actually do, I was extremely skeptical of it, because my wife, a few of my friends, etc., they visited chiropractors, they'd go in, he'd make them feel worse than when they came in. And this was not just one chiropractor, multiple different ones. They end up feeling worse after the adjustment. And what almost always happens is like, well, it'll pass, come back next week and we'll do something else. And that to me, like, why would I come in, pay you to make me feel worse and come again to make me feel even worse next week?
Well, it depends on what it is. I mean, it's, if you're looking at trying to correct something, if your finger's bent sideways, it's probably not going to feel very good to put it back.
No, but yeah, right? One thing is if you're correcting it, but
Yeah.
the other thing, if you didn't fix anything and it feels worse.
Yeah, I think it all depends upon the communication. What is it that you're doing? Are you collecting the data? Are you going through proper steps? Or are you basically running, a cattle pen? I mean, I think that's a piece of it because and listen, when I say this, I'm critical of the health profession as a whole. We could all do better. There are wonderful chiropractors out there. They're doing wonderful work in a wide variety of different chiropractic applications. Those are the people that you need to seek out, right? But, not everybody is the best in their class. Okay. So I think, if you do find somebody, expect to pay them a little bit more for the services, like what we do, I mean, you should expect to pay more if I'm your last guy on the list, right? And your surgery that you had a full spine cage didn't work. That's a high risk patient for me. And so what's the price point on that for my expertise? People don't look at you as expertise in chiropractic or with expertise in chiropractic, which is sad, isn't it?
Well, I'll jump in and make a point here that because I think that medical practitioners as a whole kind of get stereotyped is kind of what you're saying there. And if we step back and we just look at anything, like how many personal trainers are actually good?
Yeah. Same.
Right. There's going to be a top 10%. There's going to be a bunch that are in the average. Right. Now the intent across the board with all of them is probably good. How many,
I agree with
how
that.
many strength coaches, how many teachers, are actually
mechanics.
very, very good, or mechanics or whatever. So we expect it in all other fields, but we expect profession. We expect everybody to be experts when we go to a medical field where they're all human. They're all going to follow the same bell curve of any other profession. I think we fall on the grounds of just being ignorant to that fact that we go to one or two and we don't realize that's like seeing two shitty tutors, for math, but you don't realize that they're a shitty tutor because well, in math, you kind of know because your grades still suck, right?
Yeah.
Right. Now, this is a good point, though, because if you have math tutors and your grades still suck, you're probably going to look for a different math tutor. Yeah. But if you've seen different chiropractors, but you still suck and everything still hurts, wouldn't the logical conclusion be maybe I need to find different ones?
With our buddies, we have that instant feedback loop that we're still in pain or we're in more pain.
Yeah.
And that directly tells you that, maybe this isn't great.
Well, the thing is that we don't have,
it.
in chiropractic, I don't think that we have the social standing that they do in medicine. I mean, if you think about it, your medical doctor who may have taken care of your family for the last 20 years could accidentally goof up, kill grandma, go to the funeral on Saturday or whatever it is, and everybody's super proud and happy that medical doctor came in, right? He screwed up. All right. But then on Monday, you're going to take your kids in for their shots by that same guy. Now, let's go ahead and replace that with the chiropractor. Yeah. Well, that's not going to happen. Put him on the stake. Light him on fire. The social standing is different, right? And so
I'm okay with setting it on the fire.
I know, but I did it. I know. But the thing is that the way our society works, it's the responsibility is somewhat waived, isn't it?
That's a strange concept.
Isn't that bizarre?
Yeah, there should be a similar level of standard of how you react.
You would never have anybody say, well, I'll never go to another medical doctor again. But they will go ahead and say, I'll never go to another chiropractor because. But here's the other side of it too. Not everybody does the same work. Now, if you go ahead and you go to a gynecologist, okay, neither one of you guys probably would go. But if you did, all right, you would expect the same no every office, right? But if your gals went, they would understand that there was a certain standard of care for that. Chiropractic is the Wild West still. You don't know what you're going to get.
I'd like to add on to that, though, specifically with gynecology. I'd say it might be a little more the Wild West because it is ridiculous how horrible it is.
Well, I've never been.
Yeah. Well, I have a wife. I have a really good wife, and I went through the trouble of looking into it, and the majority of gynecologists are horrible. Yeah. Probably worse than bad chiros.
But can we say they all do the same kinds of things though? The same presentations and platforms? Like I said, I've never been to one, but when I talk to the girls, they're like, yeah, it's pretty much you have an idea what's going to happen. They do the same things every single time. And, they may have maybe additional tests and things that they throw into the mix, but the core of it is this.
But that's where the trouble is that a lot of them do not go through the trouble of going beyond the doctrine and education of the dogma.
Oh, yeah. Well,
Yes.
now you're going back into where we were talking about evidence-based medicine or evidence-based science and going through and saying, okay, what is dogma and what really works on the ground? For example, there's a technique that when you're doing an assessment, if the patient is prone and they lift their leg up and then you go ahead and have them put that one down and they lift the other one, the heel that goes highest, the test is a sacral apex test. That is the side that the tailbone has spun that direction or the apex is gone. Well, that's not the case at all. It's just like if you have a short leg, there are chiropractic doctors that really believe that if you have a short leg on the right, that is a PI ilium. Well, what I'm finding when I go ahead and I do x-rays is that I'm going to say 80% of the time, because I went through and I took all the pictures and I looked at them on all my files. It really can be, it's rarely this anymore. It's now this, because if you go and you go look at the education program, they're still teaching in chiropractic college stuff that happened during the Industrial Revolution. Well, in the Industrial Revolution, up until the 80s was, work position was standing. What's the basic work position? The recreational position, the travel position, it's all sitting.
The existing position nowadays.
Yeah. So, the sacral apex test may not be quite accurate, but what it does tell me is there's an SI joint problem. And when I go and I see that there's a leg length discrepancy, it's a sacrum, not the pelvic primary anymore. And if you've got knee issues, it typically is coming from the pelvis doing this, not doing the sagittal like it used to be, because the position's changed. And we're still in the education system, we're still teaching, like I said, industrial revolutionary stuff. We're not even taking into consideration, and that's where that's supposed to happen in schools. And so now what I'm hearing is from the students is that, we look at x-rays, but what we're looking at them for now is more like the medical doctor, where is there a broken piece, or is there a rotten this, or is there cancer, or is there that, which is all important, but they don't know how to interpret it neurobiomechanically like a chiropractor should. It's fascinating, isn't it? And and again, this may make people angry, but the goal is to make it better. And I just, it's you have to be the squeaky wheel to make things happen. And and Dave tell you, I make people angry.
But that's the truth of it. Of the chiropractors that I know, the two best ones, you're one of them, are the ones that are actually not following the doctrine and the dogma and the standard of the education, are going completely against it and disagree with the standard. That goes to show something. But if the two best ones are exactly the similar route.
But it's based upon what works.
Yes. Exactly.
And what works for you, because what works for you isn't going to necessarily work for Dave or his wife, for example. And the more data that I have that I can collect, and my data, the x-rays are, there's a lot of young doctors say, well, I can't justify x-rays. Well, the International Chiropractic Association had created some time ago with a lot of their researchers this standard, which is called the PCCRP guidelines, which have to do with the parameters and the justification for taking x-rays. And it can be things like, walking problems, could be red flags, could be yellow flags, could be, range of motion deficits and things like that. There's 27. Actually, people can go online and look up PCCRP guidelines for x-ray imaging. And it's out there on the internet. I actually have the actual book. But I think it's important to know that, there is justification for taking radiographs, and those do support the need for care, especially if you're like a Medicare caregiver, for example. The more things that you show on x-ray that justify the need for pelvic care, extremity care, thoracic care, cervical care, and then you go ahead and you get your 5 regions. Well, they don't like 5 regions because it costs the insurance companies more money to pay you 5 regions. But I've played that game before. You have to document, you have to evaluate, you have to collect the data, and then you get to play the game. But they still attack you because you're not doing what the majority are doing. Isn't that garbage?
Dave Tate here from Elite FTS to talk to you about bands. We've been a supplier of bands for almost 2 decades now. So I've known my way around the band landscape. When I'm talking about bands, I'm talking about floss bands, long bands, short bands, bands you can use for resistance training, mobility training, body weight training, and flossing. One of our most popular bands, or actually our most popular bands, are the long bands. The long bands are typically used the most with squats, bench presses. Our floss bands are bands that you wrap around the joint to be able to help with mobility, circulation. And the short bands are designed for shorter range movements, bench press, deadlifts, and a lot of times people will use them with resistance machines to help accommodate the strength resistance curve. Head over to elitefts.com and look for bands in the toolbar or blowout menu. All right, during the break, we put up a video here that would be, I guess we can just say a case study. So what are we looking at here?
It's all anecdotal information, right? That's what everybody says.
Yeah.
Well, what happened to this young lady in particular, she'd had a dumbbell, in training, actually, before she even got there. So she had what I call an inverted rib. And it's interesting. People don't really think about your ribs and how structurally they are, but they start right in through here. The first one comes around in a loop, and it's just like this, and it sets down just like this off of T1 on the backside, and then this here is right underneath his clavicle right here. So what had happened was that when she had brought that dumbbell up, she had dropped it back. When she dropped it back, it kinked. So basically what had happened was
What is she doing? What is she doing to throw a dumbbell?
Well, they're just doing the same one.
Yeah. Why in the hell would somebody be doing this? So
Let's let the pro tell you.
So it's like circus dumbbell.
It's a circus-sized dumbbell that you press overhead, and usually you lock it up.
No, I understand that, but from what he was saying there a second ago, I'm like, what the hell kind of exercise is that?
Yeah.
Well, it's not exercise.
Yeah.
I don't know why we have it, but it is.
Okay, so
All
circus,
started in the circus, right?
so circus dumbbell went south.
Yeah, it absolutely did. And so it created a torque in that curve, that normal curve in there, and kinked it.
Yes.
And I call that an inverted rib. Sometimes we'll see that when people tighten really tight in a squat, and they'll go ahead and they'll get that executed. And then what'll end up happening is and you know what I'm talking about, right? And you get in there and it'll go ahead and invert the rib. And sometimes you'll end up having both of them go. And so it is a very complex thing to try and unravel, because you're trying to unwind living bone that has been torqued.
Now, is it the bone or is it the tissue that's pulling it?
Yes.
So it's both.
Yeah, because I mean, they're not, they're all intertwined, right? And then there's also a nerve component in between those ribs as well. So you got your intercostal ribs. So, and then it changes your shoulder dynamic. It goes into your neck via the scalenes. Your pec is also firing weird. Your sternum goes wacky. Your clavicle needs reset. Typically the shoulder itself needs, it's all integrated. And so I guess what you can say what I do when we're in events, and of course, we're going to be doing the official Strongman games in November, and we're going to have a class also under strongmandoc.world. But at any rate, this is triage. This is triage chiropractic. This is battlefield chiropractic, if you could imagine such a thing, right? But yeah, this was
Only
a
the
tough.
medieval knights had you.
Well, you've seen, like I said, you've seen some of it, And
So this is the case right here. Right? This is battlefield, right? So my question there would be, this is just getting them back to play.
Yeah.
Would the treatment be the same if it's post-competition and you're trying to just restore? Because I see two philosophies here. There's one, let's get them back so they can just compete. And yes, they're going to keep fucking themselves up. Yeah. But they're going to be able to finish. Then the other would be probably not need to be as aggressive, because we want to fix this for good.
Well, and again, it depends on, each person is different. One time I had a chiropractor tell me, it's like, well, we wouldn't do that smackdown treatment on a 2-year-old, would you? And I go, well, no. Well, if that's all you do, and it's like, you fit the treatment to the patient, right? So you make it to where it's beneficial to the patient. You don't try and treat the patient to the treatment, which is a mistake that I think most people make.
Yeah, but the patient, the patient's mindset can change.
Oh, instantaneously. Seriously.
If they're competing, it's like, I don't care what you have to do. If I die tomorrow, that's fine. Just make it so I can finish.
And that is the big difference. And I have to do it in 5 minutes or less.
Yes. Now,
right?
that following day when they come in, competition's over.
I can take my time.
It's a different mindset.
Yeah, I can take my time. I can go ahead and unravel it. You know, you can have more of a conversation. You go through the process.
Yeah.
Me, I have to do things quick and dirty, get into that athlete's mind as quick as I can. And, you know, with my sense of humor, a lot of people are like, well, your sense of humor is a little different. It's like, yes, it is. But what I'm trying to do is I'm trying to redirect that patient. I'm trying to get them to focus on the fact that we're correcting them. We're going to have fun. It's going to hurt like hell. But you know what? Let's laugh about it while we do it.
Well, in competition, this brings up another question to where there's still a point.
Yes, there is.
Right, to where this may be able to help you finish, but the end result's going to be too detrimental. You know,
we have conversations like that. There was one athlete at the Arnolds, for example, who he came in after, I think he did a frame carry or something like that. And I think he had some scar tissue on his brachial plexus, which is the big nerve bundle, if you will, that comes off of your cervical spine. Well, he could hardly raise his arm. And so we're going through that whole Arnold weekend trying to keep him in competition. And that conversation came up many times. It's like, okay, listen, how important is this to you? Because this could cause permanent damage. Mm-hmm. And if you want to do this, I will do everything I can doing my triage chiropractic, whatever that is, whatever it takes, but only doing chiropractic on him, mind you. Okay. We'll see if we can get you through this. But I want you to understand there is a risk here that you may not be able to use your arm afterwards. You know what? He went through the whole thing. He even challenged Brian Shaw with only one good, fully functional working arm on the, 630-pound stone or whatever, the stone over. Mm-hmm. He went for it and later became a world's strongest man champ himself.
Now, has there ever been a point where you've had to refuse treatment because of that? Because I would still say that they're not really in that right mindset.
Well, it's
competition time is a dangerous mindset.
That's what I'm saying. Now, they should have people around them. They should have enablers and realists. So they should have people in their camp.
I always tell the truth.
Yeah.
And I always make sure that they understand, you know, if we're, you know, just like in that case right there, this could be a permanent problem for you. You know, we have to have those conversations. I think that's important.
Yeah.
So I do both because the thing is like, okay, if you're going to do this, I'm going to do it with you. I'm going to try and keep you as safe as I can. Guardian angel, safety net, whatever you want to call it, I don't care. I mean, we've had athletes that have blown off their biceps and continued. We've had athletes who've blown off their triceps and continued. The ones that blow off their kneecaps, they're done. All right? They're just done. And that's the saddest thing because, you know, I've become friends with so many of these people, as you're well aware. And it breaks my heart to see them go down and then help get them in the ambulance, you know? So my goal number one is to try and keep them as, you know, between the lines as I can. Yeah. But, you know, most of them are so far outside of the box when they get there, you know, and you know what I'm talking about. So it is a challenge. Mm-hmm. It is.
All right. Now, so back to this case here.
Mm-hmm. And a good, safety net with that, by the way, is whenever I had injuries and I had plenty in competitions, I have my wife or my coach talk to the physio to get an honest opinion because I know I will not. Well, I could do the right one, but I'm probably in that competition mindset and not preservation mindset.
I think, you know, that's the other benefit too, is I get to know you guys. Yeah. You know, I mean, I've been around, you know, I've taken care of people like Magnus back, you know, way back when, Phil Pfister before he was a world's strongest man champ. So a lot of these, you know, people that you're seeing right now that are international world champions, I've known them since they were baby strongmen, strong women athletes. Yeah. So I got to know them. I know their sense of humor, and I know, and they know me. But the big thing is that it's become very interesting when they see me come up. They know that Daddy's home, so to speak. Right? I'm here. Let's get down to brass tacks. Let's see if we can make this happen. Because my job is to try and keep them in the show. Mm-hmm. You know,
funny story before we jump into the case study. I was at the Arnold and there were some foreign athletes competing that haven't met you or had the pleasure yet. and they worked on you. And I asked, well, what do you think of Todd? Because like I fully trust him. I recommended that they actually see you and talk to you. He's like, he talks so much. I don't understand half of what he said, but I feel so much better right now.
Yeah.
And that was the goal. Like,
Yes.
you distract them fully through it.
I have
get
to.
it done.
I have to. And I say things that people are like, well, that's not appropriate. Well,
Yes, those were exactly the words coming out of
right.
their mouth.
But at the same time, it's like you have to take them out of their being afraid, scared, hopeless. Am I done?
It's like, who the hell is this guy?
Yeah. And then at the end of it, it's like, okay, look what we just did.
Yeah.
Johnny Kelly over when we were in London, for example. I don't know you want to get to this. I'm so sorry. But Johnny Kelly, he took one step forward and then passed out, carrying a 400-pound shield. And he fell down. And of course, all the emergency crew goes there. I always walk out last. And the reason why is I want the athlete to be safe and that there's no, huge damage risk, whatever. And then, when I start seeing, the EMS crew kind of looking around a little bit like they're not sure what to do, then I walk out. And then I go ahead and I went over to Johnny in this case and Johnny's laying on the ground. They just rolled the shield off his chest and he's bleeding a bit because, when he fell back, the shield hit him in the face and he busted his teeth through his lip in through there. And so I walk over there and I go, Johnny, what you doing on the floor, buddy? He goes, I don't know. and I said, does your arms work? He goes, well, I said, well, move this one, move that one. I go, okay, now move your leg a little bit. Now move that leg. And I said, kind of wiggle around a little bit. I says, are you good? He goes, yeah. I said, looks like you got a leak coming out your face or something. You're bleeding all over. What's going on here? He goes, am I? Oh, yeah. I go, well, you're holding up the competition. Why don't you say we go ahead and get out of here? And later the EMS personnel over there in Great Britain came up and they said, that is the strangest bedside manner I've ever seen.
But it worked, huh?
But it worked. And at the same time, again, the athlete feels comfortable. They feel safe. They understand that I'm talking their language. I'm talking to them like people.
They're not talking to a medical professional. They're talking to a friend who is a medical professional.
Right. Yeah. And I think that's where I like to be. I'm their friend, I can be their big brother, whatever the case is. But I'm there to help them and get them through whatever it is that they've got going on at that moment. And, I guess that's why I'm still around after all these years, because, I have people that I'm working with that we're in process of training, but there are things you do in contests. There are things you don't do in contests. And right now we have so many young chiropractors that, graduate magna cum laude based upon a multiple choice test. And then they go ahead and they come out and they do their masters in sports, whatever. And they come out with their tent, their scraper, and a Theragun. And it's like, that is not sports chiropractic, but that's what the heck, right? And now we've got those same people now entering into, other strongman contests, internationally here or there, and they're not prepared. And the reason I'm still around is because I want to prepare them. I want them to succeed because let me tell you, all it takes is one bad chiropractic experience. And just like what you said, we're done.
Yep.
I've had a really great career, almost 30 years of working with strongmen in competition at the highest level. I've been hired, obviously for SBD, World's Strongest Man, the World's Strongest Man company. And it's an honor and a privilege, but you actually have to do it right every single time. And I know how to do it right. So why not learn from the guy who's been doing it instead of saying, oh, I know what you know. That's a problem.
They watch one of your videos, huh?
Yeah, well, and you know what? It's funny because I'll see things that will pop up, and I'll see a guy trying to do what it is that I do, and it's like, oh, okay, you've been watching my videos, but dude, you're gonna blow your shoulder, you're gonna hurt your elbow, or you're gonna hurt the patient,
which is even worse.
All that's bad. All that is bad. And so my goal is to help, with like what you were talking about, how it started with one thing and then it become a multi, release, movement with one movement. Those are the kinds of things that will accentuate their chiropractic skill sets. But here's the other thing. For me, if I can go ahead and share, and what I'm obviously writing books and things like that, but if I can share in class what it is I've learned over all these years, that will allow chiropractic to springboard after I'm done. It creates, it's like stacking boxes. You want to be as high up on the box as you can, right? And then you learn from that box. And then you have other people who are creative and doing great things for the profession. That's what I want to do.
I'd love to see someone come in, take your work and actually improve on it somehow.
Absolutely.
That would be incredible.
Absolutely. But the thing is they have to learn the work first. And, it looks easy. It looks easy, but it looks easy because I've done it for a long time. I mean, it's like your skill sets in lifting. What you do looks easy, but it's not. I mean, there's a big difference between you and your skill sets that you've been working on all these years. And
rubber bands make it look easy for him.
Yeah, is that what it is? Rubber bands? So, but you know what I mean? And the thing is that somehow, like in the Instagram world, it all gets lost, whether it be a trainer or a doctor or a chiropractor or a massage therapist or whatever it is. It takes time to get good at things. Now, I can give you a 15-year head start, and then I hope somebody can take what it is I've learned and springboard from that and advance chiropractic further. You look at the triage chiropractic applications I do in these events. Tell me that wouldn't be beneficial in an emergency room situation.
Absolutely.
I mean, think about that, and think about how impactful it could be as part of that team. What about,
emergency room, Olympics, military, any kind of application?
Well, and I'm actually looking at, working with, I've already put in an application to see if I could be one of the lead chiropractors at the VA. Mm-hmm. And so I've got people that I know that are talking to other people because, that's a special place for me. I'm actually one of the first disabled strongman athletes in the world. And I get great joy out of working with a lot of our military veterans who've come in who may not have a leg or may not have an arm or may be paralyzed or whatever the case is. Well, let me tell you something. You can't go from soccer mom chiropractor to taking care of one of those people who've got shrapnel in their back or crushed spine, right? You have to have some skill sets. And, when I'm in there and I'm working on people, I have full intent on what it is I'm doing. I have an idea. I'm focused. I'm laser focused. You know how it is when you get ready for an event and you're getting ready to go ahead and get that squat and you dial it all in. You do like Eddie Cohn. You wiggle into that position and then you go. It's the same thing for me. Every single athlete I take is a new competition for me. And if that's 100 that day, if that's 200 that day, that's a lot. That's a lot of focus, but I am exhausted afterwards.
I can imagine.
Mentally, physically exhausted because I forget to drink water because they just keep getting thrown at me over and over and over and over again. And I'm surprised I haven't died working on athletes.
So if it's somebody that you're mentoring, is it better to have the blank slate or the ones that have a multitude of different modalities? Open mind aside, right? So let's just, open mind is going to be the most important variable of all of it. Because if you have to undo all the default patterns, because typically with somebody that's got multi modalities under their belt, they're going to play around, but they always default back to what they know best.
Well,
right?
they default back to the safety net. Because it's like, well, I'm not really good at this, so let's do this instead. I think a lot of modalities that are used in chiropractic offices today are because the chiropractor can't do a good adjustment.
Yeah.
And that's going to make a lot of people really angry. But I mean, you talk to people that, you've talked to people who I've taken care of, and it's like, why can't my chiropractor at home do this? Well, I want to teach everybody how to do what it is I do. All right. Because it's a necessity. It can help. It may help that your grandchild walk again.
Yeah.
I mean, that's generations from now, but it's that important to get it right. And why am I why would I be considered such an ass for saying that when I know that we can do better as chiropractors? And like I said, there are wonderful chiropractors. I'm friends with so many people that do so many techniques. I just, in the strength sports area, that is my area. That's what I got good at. So I'm very defensive and protective of it. And promoters, promoters are a lot of times, promoters do not do what's good for the athletes a lot of times. They do what's good for prize money and trophies and, hauling guest people in. And so the care structure is less. But we can get to a point that we actually have, true recovery teams that are trained, at least the chiropractic side, trained by me, or people that have worked with either Michael Van Dyne, which or, Becky, Mayhew Wilson, who now's McLean, who really helped kind of coin the whole recovery concept. Me, I'm just the mechanic. I just go in and I just hammer stuff. So I don't really think about all of that stuff until now that I'm getting, I'll be 60 this year. And so now it's kind of like, I better start thinking about how to pass this stuff on. But to answer your question, they have to come in with an open mind. And there's very few people that have an open mind. And so it's really, really hard to find that right mix, because they do default back. And you have to believe in the product. You have to believe in chiropractic that it actually works. And I do, obviously. But at the same time, I had to prove it to myself, and I have to prove it to everybody that I touch every single time. And like I tell a lot of the young doctors, you have to wow that patient every single time. Everything should be a wow experience, And if it's not, it's like, okay, what's going on? Is there something going on with them? Is there, what is it? And most of the time, it's what's in between their head, like you were talking about, right? So in competition, I can get after things. And, like in that video right there, that young lady, she says the F word, and she's not saying Frank.
Hey guys, if you're enjoying what you're watching, make sure to take a moment to like, comment, and subscribe. Yeah.
Many, many times. But
so what's going on here that you're doing? So go ahead.
Well, we talked about the inverted rib. So I'm in there right now, and you see Mike Van Dyne, who, works with me at World's Strongest Man. And so what we're explaining, is what it is I see. And then we're discussing kind of a strategy of how maybe he could do some follow-up work on what I do. A lot of people will go ahead and say, oh, I get massage first, and then I go ahead and I do my chiropractic because it loosens me up. But what I've discovered is, and Mike as well, is that when I get in there and I do what I do, his work effort and time working has gone down by almost 2/3. Wow. And it's because of the neurology component, right? And so what we're in process of doing is I'm working on it's the other shoulder that's the problem, right? But what we're doing in through there, that's a bicep tendon that I'm rolling over. And then eventually I'll go ahead and get in there and I'll reset the humeral head into the dish, which is called the glenoid, which is part of the scapula. And so you'll see me start working that back into place. Now, the reason why you have to be somewhat aggressive is because she's been through some competition already, and all those muscles are hypertonic. In other words, they're not spasm, they're just mad. Yeah. But if you go ahead and you have your joint that's supposed to be here, right, secure, and then you have your rotator cuff that's pulling perfect right here, well, that's a solid joint. But if that humeral head, which it does in most of our athletes, it slides anterior. Well, that changes the dynamic of all those muscles pulling on that, doesn't it? So now that's going to increase the amount of hypertonicity of the musculature in that area, plus change how the nervous system works. Now, right there, what I'm doing is I'm actually opening up her sternum. And it's really interesting because, and I have to talk to some people who are like, fascia gurus, but what I find is that, most of the time the pattern is ribs here and ribs here. And it doesn't matter what sport it is. It doesn't matter whether it's man or woman. And so a lot of times I'll have to go in there and open that up. And also at the same time, I typically do both sides. And the reason why I do both sides is because I have to recenter the sternum. You got to remember, you've got your ribs. This is you lying, from the feet, we'll say, and your ribs set in here like this. This is the vertebral costal. This is the sternal costal, right? And so what we have to do is we have to try and make sure, because these all move, right? They bend, they get torqued. And the whole idea of an inverted rib is a torqued first and second, a lot of times, rib. And so we work on the one side, clear that out. And now we're on the sore side right there. And so, and you can see, people who are, maybe watching or thinking I'm getting fresh with her, but I'm actually I'm calming her. I'm there, I'm her friend, I'm there letting her know she's okay. Even when we go ahead and we get in there on that sternum, I'll just say, hey, listen, you know what, we're going to go ahead and we're going to bounce between those boobs right there. And and people are like, well, that's just not, okay, listen, you don't think she calls them boobs? All right. Are boobs new? No. And so that's the thing, you get in there and you talk in their language. I'm just one of the girls right now. Okay. And so you get in there and you move that stuff around. Now, what we're doing in there is I'm feeling a big gap underneath that clavicle because there's a hole in there. Okay. Because that rib is slid inward like this. Well, how am I going to go ahead and get that sucker to come back out? Well, I think even in this one, I go, well, I'm not quite sure how I'm going to pull this one off, but because they are all just a little bit different. And so I go through and I try and explain some of that. But, if you have zero experience of this, because, you just started your chiropractic practice, you've been out, a week, you got your Theragun and your tent and your new table, and you're going to go ahead and do what the person who taught you in chiropractic college how to do stuff, and they've never actually ever been off the campus, at all. So, it's like the blind teaching the blind. She does say some things in through here. And so as you're going through this becomes very intense, and so you hear her laughing. It's because I'm talking shit again, but it's just like you said, always. But I have to keep her, just like that, you read that patient, you read what she's doing, look at those eyes.
Just concern.
Oh, absolutely. Yeah. So how do you go ahead and you take that out? All right. Because now she's like, did you just break something? Mm-hmm. And you can see, look at the tension here. All right. So I got to keep talking my shit game, right? Go walk her through this. What are we doing? How are we doing it? Is this experimental? Well, today it is. And you can see she's getting, a little teary-eyed in there because she's scared. What have you done? So, there is a psychology behind this as well as doing the thing. Doing the adjustment. Right there, what I'm doing is I'm actually shocking the muscles. If you think about it, when your muscle goes into is super hypertonic because things are out of place, you can kind of consider it a cramp. And, us old schoolers, right, we were taught that if you have a cramp, you put pressure on it. And then that there will go ahead and help dissipate it. Well, Donnie Thompson's taken it to a whole new level with, what he does with the body tempering. Mm-hmm. It's the same concept, only I have to do it fast. It never occurred to me to go ahead and put it into a drop. And so get in there, go through the drop. Now see, there's the upper area that we were talking about. And you just let her know, hey, listen, this is what we're going to be doing here.
Which honestly goes back to that gyno part because, as I said, a lot of them are horrible because they don't communicate through the process. They just go in there and just do it.
Yeah.
Which is horrible because then if you're communicating with the patient, they're fully aware of what you're doing, what your intentions are. Well, part of it helps so much more.
Part of it's that social hierarchy that we were talking about. They're doctors. They're medical doctors. They don't have to explain.
Mm-hmm. Which, right, you say they're boobs. You could have went in and called them whatever medical professional term, but that tells her nothing. That explains her nothing.
No, it separates you from them.
Yeah,
it separates you because you're being clinical. You're not being caring. You're not being cooperative. So what I'm doing now is I'm setting some of the sternocostals in addition. This is very challenging, and this takes a while. But, they go all the way to the end of the video and you see her expression and the fact that she's walking, doing like a hand walk, spider walk. It's amazing
Scroll through
to see it. But you can see, she's starting to like, okay, I might live through this, and then we go through the rest of the process and calm her down. And that right in through there, that was also the first rib again. So, you're taking it from all angles sometimes because you have to. Now, would she be exactly the same as somebody else? No. And that's what makes you different. But, the doing it for years and years, it just, that's where it becomes evidence-based. Mm-hmm. It's not theory anymore.
Fast forward more.
Yeah. See, that look says it all, doesn't it?
Yeah. It's a very different look, suddenly, from the concern.
Well, and that's it, Now, I'm trying to think, okay, it looks like to me I'm going to do a pubic maneuver. All right. Now I've changed this to where I get more motion out of it when I hook the thumb. But again, how are you going to go ahead and approach this? I do it awkwardly, but I make it as awkward as I can, and then people laugh about it, and then I'm able to go ahead and get the job done. But that is a very, very powerful maneuver, and it's interesting. I've got patients who come in who've got rods and screws that are, holding their spine and sacrum together, and there's not much left to move. But I can still work on the internal and external rotation of the femur heads themselves, and also the pubis. And you get that pubis in there, and it's amazing how that takes so much pain away. And it helps a lot of gals that have menstrual cycle, horrible menstrual cycles, which of course, again, these are things you talk about. Again, I'm just one of the girls when we go through the whole process there. And then you just say, okay, listen, I'm going to go through this and we're going to assess this. If you make it awkward, it is awkward.
Yeah.
Right? Unless you can make it funny awkward, then it's like, okay, let's just get this done. Right? And can we do it faster?
Can you just be done with me so I can be done talking to you?
Exactly. But the thing is that as the time goes a lot faster for them. And so it's just, a part of it. Now, obviously we're still friends. She's smiling-ish, but yeah, she'll go through. Yeah. She's a great example of what we do. That's legal if you say good game.
Yeah.
It's baseball vernacular. So, but again, by the time we're done, we're buddies. We're trying to get things nailed down. So, but yeah, there you can see that in her situation, it's taken a long time to go through it, and you could probably zip forward some more, and then you'll get back to where she's. I think it might be where she's doing, the tiger crawl or whatever.
Keep going.
But I don't know who was sitting over there against the wall, but some of those guys, they sit against the wall and they're like, yeah, you know what? I don't think you should be engaging that person that way. And it's like, well, but you're not trying to get them better. And the guys too.
All right.
Oh, here it comes. Look at this. She couldn't put pressure on her arms at all, let alone do anything like that. She's just testing it out. Isn't that fun to watch? And is she frowning? Is she crying? Look at this. Now she's going to do a bench or push up. She could not put any weight on that arm. Now,
having a dislocated collarbone, I can tell you doing a push up after something like that is impressive.
Look at that. And so, there's a lot of layers to this, and I always get my hugs.
All right.
That's where the friendship is, right?
Yeah.
You're not allowed to miss, and it would break my heart if I wasn't able to help her.
Yeah.
So with her, she came in because of the collarbone. Sure.
It was actually first rib, inverted rib. Mm-hmm.
But you treated everything. Is that what you're going to do with everybody?
Yeah. Yeah. Because the thing is that you have to get that whole body to be in harmony. I'm still a chiropractor.
Yeah.
I still believe that the nervous system has to have everything open, all those pathways open. Some people might say, you know what, you're doing way too much. Well, if there's fixations and subluxations, you've got to clear them all out in the middle of a contest, because you've got how many minutes to get back out there?
Less than a few usually.
Right?
Yeah.
I
I still have to put my shoes on and whatnot.
Yeah, afterwards or during or whatever, right? But the thing is that that's the tough thing, isn't it?
Yeah.
Well, it becomes a tough thing for you, because what if you don't have that whole time?
I work faster. Do I work faster?
Yep.
I work faster.
I've seen them do some crazy miracles behind the stage.
You see me, sometimes people will watch me and they're like, oh my God, it looks like you're dancing around that patient. And probably am, because I'm hurried. I'm trying to get them done. I'm trying to do everything I can, everything I know how to do. So again, your brain and your fingers have to be on, and like we talked about, how many times do I get to miss? You're not allowed to miss. You can't miss.
Well, that kind of goes back to the other practitioners that you were speaking about that are scraping or whatever it is, because they're just going to treat that one area because that's all they're going to have the time to be able to do.
Well, but what if I said that wasn't what was needed?
Well, that's where I'm going.
right?
Right. Because I would still think no matter what gets blown up, the whole body's impacted.
Yeah, absolutely.
That would be common sense.
Do you know, when I first started this, working with Chad Coy and all this, I was the only practitioner there. I was the only one there. And then every once in a while you have a massage therapist or somebody that, was new to it, was trying to get a name for themselves or whatever. But do you realize, over time, every time I would walk in, those people would all become instantly unemployed. And it was because, one, I had to earn the trust. Two, I had to make sure that it worked every single time. And now, you see me on, I'm working with the, World's Strongest Man and working with, a wide variety of different groups and, partnered with Lynn Morehouse and OSG. And we worked with Darren Sadler and Colin Bryce. And
Strongman Champions League soon.
Soon, yeah. We're doing some work with them. I've worked overseas with Glenn Ross in the past. I've done almost everything. The IFSA people, I worked on some of their athletes way back when, but I couldn't go to Canada back then, right? So, but yeah, you have to wow the people, you have to perform, you have to get it right. And this is why I caution promoters, if you just let somebody who's, average or says that they're a sports chiropractor and their primary focus is going to be, scraping and dry needling in the middle of a contest. Now, here's something to think about. How sweaty and stinky is the gear that you have, right? Stinky and nasty, neoprene and all that's full of bacteria.
Yeah.
Right? There are chiropractic practitioners and whoever that are taking the needle, puncturing through the stinky, sweaty, bacteria-filled neoprene into the skin and muscle to go ahead and do dry needling. Does anybody see an issue with that, maybe?
I had a very big issue, and I've once seen that, and I specifically had to point out, aren't you going to wipe that down, something, alcohol? He's like, oh, but the needle's clean. I'm like, okay, but the body is not.
But see, you see, the thing is you get it.
Yeah.
Why didn't the practitioner get it?
That's
what I don't understand.
I'm not the medical expert, so I question.
Well, I always tell people I'm not an expert or a professional. I just work hard. I don't want anybody to have false pretenses whatsoever about me. But yeah, common sense isn't so common. And just because you graduate magna cum laude or valedictorian or whatever it is that they call you, because you like I said, you're the best at multiple choice tests, doesn't mean you got skills as a doctor. So people all need to be cautious and careful, and doctors need to do better. And I don't know. Like I said, when we talked off the air, I hate everybody equally, and I love everybody equally. But the bottom line for me is I want it to be better. I want the athletes to be safe, and I'm going to stick around as long as I can, as long as people will have me, because I want you guys safe.
So here, hold on. Okay. If we look at that whole body approach with how you treated her. Where I like that is whatever that injury was, outside of, weird acute type of things, why did it happen in the first place? Right? That rib may not have been a problem because the shoulder or that. It could have been a problem because of anything else, upstream, downstream, whatever it's going to be.
Well, there's research to your point that says that 70% of the time, if you have jaw pain, it's on the same side as the short leg.
Yeah. So it's how would you work with them prior to competing then?
Well, one, I think the great thing is that if they come to the office, I actually have all the data. I take x-rays, we do the line analysis, which has become a lost art too. We do the examination, we do a comparison between the two. We come up with a strategy. Typically, like I said, it's not 6 days a week, it's a couple times a week, depending on, what the circumstances are, but that's pretty standard, pretty much on everybody. Sometimes you get one that needs an extra one, right? Mm-hmm. But that's really rare in the office. But the bottom line is you go through that cycle in 6 weeks, we go ahead and we reassess and see exactly what's going on. If we put a full-length foot lift in, we've got colleagues that are still using heel lifts. Well, they're not taking in consideration that coronal component that we see in the pelvis dynamic, which responds to a full-length foot lift. That's not even anywhere in the education at all.
I'm speaking more of if you're going to work with, say, Ilya the day before or the day of his competition, just to tune up.
Yeah.
right? What would that look like? Would it look similar
like
to
that? It looked like that, and whatever it is he needs, because the thing is every person that comes in has different issues and different needs.
Yeah, well, it's going to be, of course they are, because they trained for it.
Yeah.
The training in itself is going to lead to.
But they're also coming in with their deformities. I mean, we talked about scoliosis deformity, for example, being 10 degrees, but do you realize if you have a 3-degree angulation and you may have 3 degrees here and 2 degrees here and maybe 4 degrees here, your spine's supposed to be straight up and down, and the best loading is when everything is engaged and locked straight up and down. Any deviation in that, and a lot of times people will have 3 or 4 of them that are never identified and passed over as not important because they're not 10 degrees. 3 degrees is important when you got 1,000 pounds on your back, isn't it?
Yeah.
Yeah, nobody's looking at that. Yeah. So how do you go ahead and unravel that? And that's what with the x-rays and whatnot, which is the benefit of having people come to your office ahead of time. We go through and we assess and we try and break all that down and try to address those things with certainty. And when we actually have him in competition, I know exactly where he's at. I know exactly what we need to do. And when he dings himself up, I pretty much can guess where he's going to do it. That's advantageous.
I don't want you to lose your thought for the question.
Yeah, here's an interesting question, because we discussed different fields, so like EMS or the military, etc., having this kind of knowledge or professionals involved with them. Is everything you're doing, can something be taught piecemeal to different professions, or do you think it needs to stay as a chiropractic specific professional that then adjusts to the field? Well, it's not something like, for example, an EMS professional could take out and know something that's just for that specific cause.
Well, I think it's a really good question, because, one of the components of being a member of the board and a member of the International Chiropractors Association is to keep chiropractic. Mm-hmm. And so there's an education protocol that's established. I may not like all of it, but there are basics that are taught. Those basics are chiropractic centered, or they're supposed to be, even though I see that they're veering off into PT. All right. Which, if we've got PTs that have trouble doing PT right, why are we taking chiropractors and making them PTs too when they can't do their own job right?
Well, that's part of the question, because I know some PTs that know a little bit of chiropractic.
No, they know a completely different bone setting application, and they have all kinds of weird, phrases. I got friends of mine are PTs that do it right, and I'm not going to take anything away from anybody, but I, what I feel like what I do is better. All right. And everybody's kind of like that. Everybody's a little bit biased, but I've also got all these years of experience and application to go ahead and back me up just a little bit. Right. And a lot of those people. So do you. So with that being the case, no, we want to keep chiropractic. We want to advance chiropractic. We want it to be better. But, turning chiropractic into medicine where we're prescribing people stuff or giving injections, that doesn't make chiropractic better. That just creates another outlet for the pharmacology people to make more money, the drug companies. That doesn't help people. It's already failing now. Mm-hmm. It's going to fail less when chiropractors are delivering the same exact thing the same exact way. That just doesn't make any sense to me. So, but at the same time, why go ahead and teach the athletic trainer how to do chiropractic when they don't understand what it is from the get-go? They don't understand the philosophy behind it, because philosophy is important too. What is your purpose? What is your reason for doing this? Mine's to open up the nervous system, make it function at a higher level. That becomes quantum. Mm-hmm. We want to go ahead and get into that other layer of stuff. It gets into quantum space, because there's energy. I mean, just like even, talking to that young lady there's an energy transfer there. There's a trust transfer there. There's a feeling that goes on there. That's deep. Mm-hmm. That's really deep.
So if you take, for example, an orthopedic surgeon that would deal with bones, muscle injuries, etc., is there something that he would benefit from learning as a chiropractic practice to know that maybe he shouldn't intervene on a surgical level and pass it on to an actual professional chiropractic specialist before intervening medically and surgically?
The people that are worse egomaniacs than chiropractors are surgeons. You're not going to tell a surgeon anything. You're just not. They're set in their way. They've got their most of these guys have been institutionalized from kindergarten all the way through med school. They've never been, they just do what they're told to do, right? And so this is the system. This is how we do it. This is how we're always going to do it. The end. You go ahead and say, oh, well, we're not going to do, physical therapy now. We're going to go ahead and put them into chiropractic. Well, the only reason they would say that is because the chiropractor's trying to do physical therapy. That's not what we do, or it's not what we traditionally have done. And what I'm trying to bring back to the fold is I don't want that to happen. I want us to be great adjusters. I want us to take it, I want to take what, like we said, this triage based stuff and plug it in everywhere. I mean, listen, we've got live fire training that we're doing on November 20th, tied in with official Strongman games down in Arlington, Texas. And this is a huge opportunity for doctors to participate in something that they've never done before. Everything that in education, if you look at it, it offers is a safe space, a protected space. Well, when you work with me, there are no safe spaces, none. So what Lynn Morehouse has is he's got 400 athletes from all over the world that are coming in with all kinds of things. And several of them, they come in with all kinds of things. So if I can go through an 8-hour course, teach you as much as I can, and then go ahead and take you to the mat, or the table, if you will, and then we're going to go ahead and plug in what it is that you've learned, and we're going to do that for 4 days. I call it live fire training. Tell me.
Triage residency.
Absolutely. And it's a crash course, and it's intimidating. It's intimidating. And that's part of the problem. But tell me what better way to learn sports chiropractic than that methodology. It's not classroom.
Yep.
It's not classroom. I mean, classroom is a part of it, but 3 days afterwards of implementation is huge. And come Monday, you're not scared of that patient that comes in that's all effed up, because now you have confidence to go ahead and apply now what you've learned in the triage aspect in your clinic, but you can take your time, to your point.
I sit through conversations like this, and just right now when you were talking about the orthopedics, I realize how fortunate I am to have the orthopedics that I've had, because with both hips, straight up, I was told this is going to happen at some point. But the further we can kick this can down the road, the better it is, because there's a lifespan of what the prosthetic's going to be.
Sure.
So they would always recommend, the physical therapy, actually for the hip physical chiropractic, MAT. We went through a lot of things. It's like, go through all those things first, about probably 2 years. So as soon as we start the cortisone, the clock starts. Right. Because that's the last thing before. And it was 3 years. Granted, he still knows he's going to get the money, but it could be 3, 4, 5 years down the road. I've never had the one where I've gone in and they're like, oh, look, we have to do this next week.
And that's unfortunate, because that is actually a rare experience.
I know
the
that,
doctor
but
will not tell you, what, we got to do it this week.
It's the only experience I've ever had. I just have,
You're lucky.
Serrano's my doctor, right?
Oh,
so
he's a great guy.
My referral, my referral person is good.
It's because he cares.
Yeah.
Dr. Serrano's a great man. I mean, he's a great guy. And boy, he's a joker too, isn't he?
Oh, yeah.
Oh, he'll poke at you. No, he's a good dude. But no, he cares.
But I have seen it on the other end, though. To where somebody will go in and it's like, no, this has to be done, this back surgery or whatever it is.
This is exactly what brought it up. Yeah, I have a friend that was competing in Strongman, had a spine issue, got them fused because the doctor said that is the only thing we can do for you. This week we have to do it. And that's it. He quit Strongman. He can't lift anything heavy because of that now. I don't know his full medical extent. I'm not a doctor, but I'm fairly certain there's other things that could have been done.
Well, unfortunately, now we'll never know.
Well, exactly.
But at the same time, I mean, who do you go to in between? And as an athlete, you don't know, especially with your previous experiences. Your experiences have been good, but a lot of people, when they come to me, they've been to 4 or 5 other practitioners of a wide variety of backgrounds, a lot of them colleagues in chiropractic. The ones that I absolutely adore are the ones that my chiropractic colleagues send to me, and that is so rare. They'd rather send him to a surgeon than to me. Well, why? We're colleagues, maybe it's because I beat everybody up, verbally here, but I don't know. I'm not trying to be, I'm just trying to be fair, and I'm trying to be factual about it. I mean, I love what I do as a chiropractor. You see me, I mean, I light up. I mean, and I heat up too, as soon as I start working on the athletes, and, there's great joy in that, but, there are components of it that, really drag you down too.
Well, I could see what they're doing if you had 5-6 years experience, but you're doing this for 3 decades.
Yeah.
That should change it. So somebody who's got 8 years experience won't refer to somebody that's got 30, but will refer to a surgeon.
100%.
Yeah,
I see it all the time.
Earlier, I'm genuinely mean it when I was fully skeptical of the profession until I met you. That goes a long way.
Don't you think that's sad though?
Yeah.
I mean, it's sad because there are talented chiropractors. Fortunately for me, I've got relationships. We've got all friends that are all common, and I'm lucky to be here. I don't know how many chiropractors you've had that have actually talked about doing chiropractic on this. And you've got almost 400 or so videos that you've done. Which is amazing. Congratulations. That's wild. But at the same time, it's like, how do we change it? How do we make it better? And, that's why I got on the board of the ICA, and we're doing it through the ICA Sports Council, trying to make a difference, trying to make some headway, trying to bring the kids around. And, many of the people that are already out there, they're in the trenches. They got to pay that $300,000 back somewhere, one or another. I shouldn't be as critical as I am, maybe, but the young students that are coming in, maybe those are the ones that we can help and make chiropractic better through them.
What should the strength athlete look for?
Well, one, you never want to get a side posture in the middle of a strongman contest unless you're completely done and pretty much broken. Okay, that's number one. All right, and unfortunately, if that's one thing to be careful of. The other thing is you in the middle of a strength competition where you're using muscle tissue, you don't want muscle tissue stabbed. You don't want to get an infection in the middle of that. Flesh-eating bacteria is a real thing. It can happen. And there are those that say, "Oh, well, I've never ever had that happen." Well, He's
not won the lottery either.
Yeah. Well, I mean, I know of one of my patients. Her daughter's boyfriend got dry needle and got a flesh-eating bacteria and took him in the hospital and was killed him. So, can that happen? Yes, it can, so hedge your bets again. Scraping, why would you scrape a muscle that's actively, being worked in competition? Why would you scrape it? You want all your muscle fibers going, right? You don't want to break that down. So, massage therapy applications, you don't want to get into stretching anything either, passively or otherwise. So that's why a lot of compression activities, Becky does a really good job, with developing that. And then Mike carries on, when we go ahead and go to competitions. It's not the same standard stuff that you would do in your office. You have to pull back on it so you don't create an environment in which that goes from spazzy to super loose to seizure level spasm, which could take you completely out of the contest, right? And the same thing in chiropractic. In competition, you want the guy that's going to do as much as he can without negatively affecting that stretch receptors. Get your mobility back, things like that. They may have to do just light drops on you. I can't tell you what they're going to do, what they're not going to do. What you watch for is that if the one signal is if they bring out all their dry needle equipment and everything else and try and put you in side posture, that's the guy you stay away from.
Would they be looking for those same things if they're just looking for somebody in their local area?
No, I think when you're in your local area, it's a different frame of mind. It's just like, when you're in the middle of competition, whether it be that patient's frame of mind, the speed of which you have to act, the triage aspect, you do have some of that triage component when they come in, especially when they're hurt, but you can take your time and then you could do all those other things. If you need red light therapy in the middle to go ahead and recover, go ahead and do that. If your chiropractic offers that, I don't have an issue with it. There are chiropractors that are even more straight than I am, if you will, that say, oh, nothing except the adjustment. I'm not going to say that necessarily. I think that there are other things that you can do. If you don't do them, then send them out to have somebody else do it.
Well, how do they avoid the experiences that he was talking about?
you don't get that until you get it. I've sent patients, after they've been in my office, to chiropractic docs all across the country, and I'll call them up and talk to them, and I'm like, oh well, we got a complete good understanding what to do, what not to do, and then I get a call from the patient. They're like, what kind of nut job did you just send me to? There's no guarantee.
Are there any red flags?
You don't know until you're there. Unfortunately, I think one thing is okay, did they take a set of x-rays? I mean, if you really want to analyze, I think that's what you need to do is, find somebody that'll take some pictures and then understand and make it to where you understand why you're supposed to be there.
I guess you won't know until they put the hip wrong in.
Yeah, well, what I'm trying to do is how to flip the accountability onto the patient.
I know,
because they're part of this whole equation too.
I know, and
actually they're the bigger part of the equation.
They are, but there are some people that will go in. They'll just go in and just want things done to them too, and that's a problem. I don't want to participate. I just want you to do it to me, and then I'm fixed.
Yeah.
Where's the
participation? Just want that little relief.
Yeah.
Yeah.
So it really is a trial and error thing, Dave. I wish I could say it was more than that, but you just don't know what you get until you get, because everybody is amazing online.
Oh yeah.
Everybody is the best online. Yes, I've been out of school 2 years. I'm just that good. I don't need x-rays. I don't need to do x-rays. I don't get that. I mean, to me, that's part of the education process, taking x-rays, learning how to do them, interpret them. Am I better now than what I was when I graduated? Yeah, I sure hope so.
Could some of that be coming from in their practice, they're seeing the same thing so frequently, often and often, that's 90% of what they're doing with everybody is the same thing.
Yeah. Yeah. Well, and if you look at it, a lot of them are taught, there's this thing called the flying seven where, you go ahead and you do, clunk, 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 clunk. There it is, and then a little extra clunk where number 7 was, and everybody.
You should counted your clunks.
Yeah. There's a lot of clunkheads in there, but yeah, it's a matter of, if you just keep doing the same thing over and over again, and it takes care of the majority of the people. And I think that's why the training is the way it is. I think it just stays the same, and you never venture beyond that. Me, I'm always trying to figure out the next thing. Well, okay, that didn't work. Okay, what do I do now? And okay, well, let's experiment. Let's try that. And that's what almost got me smacked all those times by Chad Coy. I'm working on his ankle, and it's like, you son of a, yeah, okay. I got quick at bobbing and weaving, but at the end of it, we created something. And created something wonderful that I think the world needs. And I mean, I had if I have an opportunity to work for the NBA or the NFL or whatever, I mean, the things that I can do to those athletes to keep them going. But if I can train others, the things that those guys can do. And that's, you hate to say it, but this is kind of a twilight moment for me, like I said, you get close to that. Well, like I said, I'll be 60 this year. You've got to turn it over to somebody. You have to trust somebody, but people have to, understand too, that it is a big responsibility that I'm wanting to bestow on that person. And that takes time to learn. So, people just want to be the guy today. Mm-hmm. They just want to be the guy, They can't wait to bump you out of your chair and sit right there in front of that mic. They don't give two hoots about how much you've put into it. They just want your seat.
Were we any different though?
I always respected people. I always looked at people, and I still do. I still give homage to the greats, people who are, Gonstead, Thompson, anybody, Desjardins, any of those guys that came before, because those are the giants that we're standing on their shoulders, and we need to respect that. But today it's like everybody's throwaway, us old guys, we're like the microwave. Let's just get rid of them. And that's so sad, just flush us down. And it's like, we have so much to give and so much knowledge to share. And people need to take advantage of that. But part of the reason they don't is that they don't respect us. And that's sad.
I wouldn't say all.
No, I didn't say all.
Yeah.
No.
I just said they. I didn't say all.
Yeah.
I didn't say all of them. But no, there are, you can't throw the baby out with the bathwater. But I think, we hope the cream will rise to the top and reach out to us and allow us the opportunity to share.
So how do you see the change in technology that we're experiencing now impacting that chiropractic profession?
Well, so far they haven't got the Spinal Whacker 3000 out, which does the auto smackage. You just lay down and it just goes, brrr, that kind of thing. So we don't have that, but I think, there are a lot of things that have been great, digital radiography technology, the note-taking ability, scheduling, all those kinds of things that are practical office, but they're more business stuff, right? Those things have made it easier, right? Taxation hasn't been great, which, pick on the government a little bit with that. Anybody that has to pay taxes know that sucks. But no, I think technology is coming along. I think that we need to make sure that we never get to the point that we get that Spinal Whacker 3000 and say, we're going to call it a day, because that human component is so necessary to get people well. Were there any topics you want to talk about I didn't bring up? No. I mean, I'm just glad, I'm just like your dog. I'm just glad to be here, So
I hate to disappoint you, but there is an automated massage table.
Oh, I saw that. Arms. Yeah. Well, but that's massage.
But it's not the spinal.
We're getting there.
Yeah, right.
This is the Auto Whacker 1000.
Yeah. So it's not a spinal whacker.
Yeah.
I need the dick whacker.
That unfortunately is multiple iterations.
Yeah, I think there's probably something like that out there.
Yeah. Whatever technology comes out, that's the first application.
It might make you blind or a eunuch.
Yes. Do you have any other questions for him?
Not yet.
No.
All right.
Do you?
Nope. I think we got it.
Well, thank you
so I want to thank you for coming out. How can people find you?
If you go ahead and go to inchiropractic.com, you'll find me, or drmcdougal.com. And if you're a chiropractor that wants to learn about how to take care of strength athletes in a safe and effective measure, strongmandoc.world.
Okay. Just add on to that a little bit for all those listening out there, not just strength athletes, because I'm seeing hundreds of applications in impact sports, rugby, football, even driving, like Formula One, Indy 500, etc. All these high impact, high pressure sports that cause damage to the body that needs to be fixed instantly on the go.
Yeah.
So
no, and that's great. And the neat thing is that this technique built in Strongman works on grandma too.
Amazing.
And it helps the high jumper reach, up to 5 inches within just a few visits. 5-inch increase in your high jump. Come on. But we've had those experiences, people who thought they were done, track athletes thought they had a terrible sprain, strongman athletes, but not just athletes, but, even your kid.
Love it.
It makes all the difference in the world for them. There's some videos out there of me adjusting babies, and you can see that their little arms work better afterwards. It's pretty cool.
That's great. Cool. All right. Well, thank you again for coming out, and we're done.
Thanks.
Awesome.
All content you see on this channel and at elitefts.com is created by, take a guess, Elite FTS. If you want to help support the content, head over to elitefts.com and pick up literally anything that you need to be able to get more jacked and strong.